Hi, my name is Cassie, and today I will be discussing with you osteoarthritis and rheumatoid arthritis. Osteoarthritis is the most common type of arthritis. It causes the deterioration of the articular hyaline cartilage of the bone. This results in cartilage destruction. This affects our weight-bearing joints, like our hands, our knees, our hips, and our spine. It happens due to the wear and tear of our joints. Some risk factors include being of older age, being overweight, having repeated injuries, strenuous jobs, and genetics. It is not systemic and it is not inflammatory. Joint pain can occur due to the grating of our bones, bone breakdown, bone spur formation, and cartilage and bone spurs floating in the joint space. Rheumatoid arthritis, on the other hand, is an autoimmune condition that causes the inflammation of the synovium of the joints. It affects our joints in a symmetrical fashion, most commonly affecting our fingers and our wrists. It is systemic and can extend to our heart, our skin, eyes, mouth, lungs, and can cause fever and anemia. Inflammation is present with rheumatoid arthritis. Joints will be warm and red. Osteoarthritis is the hyaline cartilage breakdown and wearing away of this. It affects the in and outside of our bones. Inside of our bones, we have sclerosis of the bone, which is the abnormal hardening of it. Outside, we see osteophyte formation, and this results in the grating of our bones, called crepitus. Parts of our cartilage, bone spurs, and underlying bone can break off and float around in our joint space, causing extreme pain, stiffness, deformity, and limited mobility. In rheumatoid arthritis, we're going to see three different stages. First, we see synovitis, which is the inflammation of the synovium. White blood cells invade the synovium, causing it to become inflamed. This inflammation leads to the thickening and formation of a pannus. Formation of a pannus is just a layer of visceral fibrous tissue. The pannus can grow so large that it damages the bone and the cartilage within the joint. The space between the joints will disappear and ankylosis will develop. Bone ankylosis is the fusion of our bones. The patient will have major stiffness and immobility of their joints. Osteoarthritis, we can see outgrowths on our hands. So these are called nodes. So we can see Herbin's node, which is the most common, and it's found on our distal interphalangeal joint. So it's found right here. Bouchard's node is found on our proximal interphalangeal joint, which is found right here. We can see sunrise stiffness, which just means in the morning they experience extreme pain. So this lasts for less than 30 minutes in the morning, but gets progressively worse throughout the day because, again, osteoarthritis affects our weight-bearing joints. So if you're on your feet all day, your pain will be greater throughout the day or increase. You'll see tenderness when touching your joint site with bony outgrowths. You'll experience grating or crepitus of our bones, and this is only in our joints. So it's asymmetrical, uneven, and only limited to the joints. Rheumatoid arthritis, we can also see sunrise stiffness, but the pain is greater than 30 minutes in the morning. We can also see soft, tender, and warmness in the joint, swelling of our joints, symmetrical, and our synovium is affected and inflamed. It is also systemic, so it can reach our lungs and our heart. Stages of synovitis include the three that I talked about before: synovitis, pannus, and ankylosis. To demonstrate inflammation, I'm going to be using my arm is not red. If I rub the brush on my arm seems to get red, and this is what our joints will look like in rheumatoid arthritis. In rheumatoid arthritis, we see different things that will indicate what they have. So with rheumatoid arthritis, you'll see ulnar deviation and a swan neck-like finger. Osteoarthritis, you'll see the Herbin node and the Bouchard's node. Some tests for osteoarthritis will include an x-ray. So the x-ray shows our bone, but not our cartilage, but it's still helpful in showing osteoarthritis. So we can see the presence of bone spurs or parts of bone deterioration, sclerosis of the bone, which is just the stiffening of it, decreased joint space, osteophytes or bone fragments in our joints. We can also do a CT and MRI for our knee and our vertebrae. For rheumatoid arthritis, we're going to use blood testing. So if they have a positive rheumatoid factor, an elevated erythrocyte sedimentation, a C-reactive protein, which just shows the inflammation in our bodies, and if it's higher, that means that they might have rheumatoid arthritis. And we're also going to use an X-ray to show joint deterioration. So today I spoke with you a little bit about osteoarthritis and rheumatoid arthritis, and hopefully you'll be able to understand them a little better. Thank you so much for listening.